Welcome to North of 60. My name is Heidi Schweighofer. My guest today is Jennifer Mangano. Jennifer is a physical therapist specializing in pelvic floor therapy at Western Reserve Hospital. She received her degree at Ohio State and has spent more than 25 years developing programs for women and men with pelvic dysfunction. So this is going to be a very interesting show for all of us, I suspect. Jennifer, I'm so glad you're here. I can take my glasses off now.
Thank you for having me.
Tell me a little bit about how you got into this specialty.
So I always say I was just extremely lucky. When I graduated from PT school, there wasn't a specialty in this. And so I was one of the first people in Ohio to be trained in pelvic floor dysfunction and urinary incontinence. And it kind of grew out of just a need and an awareness and the development of pelvic floor therapy for people. And they would come from all over, like Cincinnati, Philadelphia, all over the state, because there wasn't such a need and there wasn't anybody to treat them.
I had never heard of this before finding you. So are there other,
Oh, yeah.
Is this a common?
It is, and it's really grown into its own specialty at this point, and there's lots of men and women trained in it. It tends to be mostly females that do the vast majority of it, but yeah, it's definitely quite a bit in this area, as well as all over Akron and Cleveland area. There's quite a few of us now.
And your Western Reserve Hospital so darn close to
Yes.
Hudson. It took, like 20-minute drive and we're there.
Yep, and actually that's why I came, is because there wasn't a large presence for women's health here and pelvic floor therapy here, and I really wanted to leave maybe a legacy here, develop a program that would be something that multiple generations maybe trained and learned from. Good
for you. It seems like when we talk about this, we tend to talk about it as we age. So is a urinary incontinence, does it increase with age? Does it just happen as we get older? Why does it happen to so many older people that I know?
So the easier answer to say is that it does affect all ages. So we used to think it was only an age-related dysfunction, but I have had young runners, gymnasts, people who have a lot of repetitive activities will actually end up having urinary incontinent issues.
No kidding.
Yeah.
Athletes?
Athletes do, quite a few, because it's a lot of stress on the pelvis. The pelvic floor muscles are designed to hold everything up, and sometimes when it's been repetitive traumas, they can fail. But it is common that as we get ager, just like everything else, things don't work quite as well as they used to. So there are age-related changes to the actual bladder itself. There are age-related changes to the nerves that go to the bladder. And then also the cortex of the brain has to interpret all of that, and sometimes lifetimes of maybe misuse of the bladder, ignoring bladder symptoms when they come, or going too soon, just in case peeing, all those kind of things can actually change the body's ability to discern when you need to go to the bathroom, and actually will cause you to have some urinary incontinent issues, frequency and urgency issues. And all of those can be somewhat age-related, and some of those are also just behaviorally changes.
Had no idea that, you don't even think about going to the bathroom when you're young.
I tell that all the time. When everything works great, you don't think about it. And as you get older and things aren't working so great, all of a sudden you start really paying a lot of attention to it.
I always had heard that it was in women, childbirth, had an enormous part to play in women having urinary incontinence later. Is that true?
It is true, because when the baby comes out of the birth canal, it will cause changes. But they actually show statistically that women who have childbirth, vaginally or cesarean, are actually both equally set up for having urinary leakage or bladder issues. And so we believe it's the 10 months carrying the baby. So we tend to be pregnant for 40 weeks, so that's why I like to say 10 months, because you're not pregnant for 9. That's a very long 9th month.
You ain't kidding.
Yes, it is causes, because there's a lot of changes and stress on the pelvic floor. But as men age, the statistics come up so that men and women are almost equal for urinary incontinence over the age of 65, or frequency urgency type issues. So it becomes it levels out once men catch up with us as they age.
Is theirs related to prostate?
Yes. So most of theirs are related to prostate, but also those general age-related changes. The bladder itself, doesn't hold as well. The nerves that go to it are a little bit more sensitive. So some of those are also the age-related changes that women will go through, but then the prostate itself, as it encroaches down on that urethra, will also cause them to have increased issues.
I want to jump to something, a question that I'm sure you can answer. UTIs, it seems as though all of a sudden, so many women and men, me, turned, 65 or 60 something and started having increasing UTIs. Is that related to this?
So it can be. Obviously, you have to be medically checked out for all of that.
Yeah,
obviously.
I know.
So yes. So a lot of times what happens as we age, and especially for women after menopause, you'll start to have atrophy in that area. So that atrophy of the vaginal tissue down there and the muscles themselves can lead to more increase in urinary incontinent issues. So a lot of that is due to that. And then some of it is due to, maybe wearing Depends or some type of pad, and that irritates the tissue, but also it leaves all of that in that general area, so you can have a more likelihood of having UTIs.
How is this diagnosed? If I was to go to probably my doctor before seeing you, is that correct? I have to be referred to you?
So in the state of Ohio, you do not. We do
Oh.
require one at Western Reserve Hospital, though. So
Okay.
you typically would go to your family physician and or your gynecologist or urogyne or something like that for a diagnosis specifically. And typically what they'll do is they will run a urodynamics on you just to double check if they think that it's significant, that they need that information. But they can actually diagnose it basically a lot from your symptoms, how often you're going to the bathroom, how you're leaking, the situation that's involved in that, and that's how the official diagnosis is made.
So just by talking to me and me telling them I go, 100 times a day, or
Right.
I go, what is the difference? Go
Excuse
ahead.
me, I'm
No,
sorry.
no, no.
But just to be clear, though, the confirmation they would run some tests.
Okay.
So, but sometimes they'll go ahead and not run them, because I don't want somebody ever to go to the doctor and say, well, they didn't run a test for me. They can sometimes diagnose this and do it that way, but the definitive gold standard would be to run some testing for urinalysis
Okay.
and stuff.
I just lost my question.
Sorry.
No, I remembered it. Stress incontinence, or stress, I don't know what to call it. The urgency that you feel in your garage when you're getting ready to go into the
Yes,
house.
you're right,
Is
there
that
are.
called stress incontinence?
No, they're different. There is something called stress incontinence, and stress incontinence, so your bladder in general, can I tell how the bladder works?
Oh, gosh,
All right,
yes.
let's go to that.
Yeah.
Because this, to me, makes more sense. Your
Yes.
bladder in general is supposed to be relaxed. It's kind of like a little empty balloon. It fills up with urine at a nice steady rate. Your brain is sensing it. It's going, yeah, you're filling up, but you're not full, right? So it's taking an eye on that. Your bladder continues to fill. The sphincters and the muscles seal that shut so that you hold and you aren't leaking. So when your bladder becomes about halfway full, your brain starts to sense it. It gets more and more full. And when it reaches a point where you are full, you can finish up what you're doing and you go to the bathroom. And for women, we sit down, and after we sit down, the bladder muscle actually contracts, pelvic floor muscles open, the sphincter opens, and urine just flows out. So the muscle's squeezing that out. When you have stress incontinent, what happens is the bladder is still relaxed. The pelvic floor muscles and the sphincters are still holding it. But the pressure of the cough, the laugh, the sneeze, the jump pushes pressure onto the bladder. The bladder pressure is the pressure of the abdominal cavity is so strong that the muscles can't override that. And so the urine flows out of what the body is trying to keep sealed. So I kind of like it to a ketchup bottle. If I put that ketchup bottle on really well and I squeeze, 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 nothing happens. But if my muscles aren't tight or the sphincters aren't tight, then when you squeeze that, you put pressure on it, urine will bloop out, the ketchup bloops out. So that is called stress incontinence. The other incontinence you're talking about is overactive bladder. An overactive bladder is the bladder itself, instead of being nice and relaxed, it just starts going rogue and starts just squeezing when it's not supposed to. It's not full.
For what reason?
Yeah, the cortex of your brain, it just goes rogue. It just does that. So the cortex of your brain is trying to make it stop, but it's just going off on its own. And if it contracts strong enough, then it will automatically open the pelvic floor muscles and that squeeze from that bladder will actually cause the urine to flow out and the bladder muscles open, which is why you're like trying to stop it and you can't, because you have to be able to seal it, stop that bladder from contracting.
Yeah.
So that's overactive bladder. And you can have an overactive bladder but not leak. So that's when you come home and you open the car door and all of a sudden you didn't have to go to the bathroom before you got there. But as soon as you get there, all of a sudden you have to go. And then you're mowing the cat over or the dog over trying to get to the bathroom.
Quite literally.
Yes, literally, yes. And so, so you make it so you still have overactive bladder, but you don't have leakage. And that's kind of like the
Okay.
beginning stages. And then we have functional incontinence. So, a lot of people are taking care of elderly parents maybe, or in the situation themselves, and so they stop being as mobile. They have bad knees or bad hips, and they have to go to the bathroom, and they get the signal normal like they should, but it takes them so long to get to the bathroom
That was my mother.
that they can't make it.
She couldn't make it.
Yeah, so she might have had a totally normal functioning bladder, but she had incontinence. So we call that a functional incontinence. So that person might do really well in therapy to get them a little bit stronger so that they can hold it better. And then every once in a while we'll get what we call kind of a transient incontinence, and that's like if you have an infection, you're more likely to go and more likely
Like
to
a
leak.
UTI?
Yes.
Yeah.
And then you don't leak any other time, but when you had your infection, you're like, oh my gosh, I'm leaking.
Yeah.
And that would be called transient. So there's many types of incontinence, so we
I
just
didn't
kind of
know
refer
this.
to it, yeah.
I thought everything was overactive bladder.
No.
That's what I thought.
Yeah.
That was the, because it's advertised
It
on
is,
TV
and it's
all the
wonderful
time.
because now we have so many good medications for it.
Well,
And
let's
so-
get
okay.
to that in a minute.
All
Hang
right.
on. I want to make sure we have enough time because I think this is truly fascinating. All right, now let's talk about some things that make it worse, and then we're going to talk about treatment.
Okay.
So I read. This is all stuff I read. So you shouldn't drink, 10 glasses of water a day because it will cause you to pee more. You should drink 10 glasses of water a day because then you won't get a urinary tract infection. You shouldn't drink coffee because it will make you have to go more. But coffee's fine, but then, it's hard to, alcohol, does that cause more or less? It's hard to know what foods and liquids are bad.
Right, it is hard. So the first question, so the water question, that's
Yeah.
a big one right now
Yeah.
because lots of people are on that bandwagon. So we typically I typically recommend about 6 to 8 ounces of non-irritating fluid. Because remember how I talked to you about the cortex of the brain? If you don't drink enough liquid, which as we age and we start having trouble getting to the bathroom,
We tend not to.
we tend not to want to drink. We also
right.
lose our sense of desire for liquids. We don't desire to drink as much, so we don't realize we're not drinking as much. But then we don't have as much liquid into our bladder, and that liquid that's in there becomes more concentrated and sludgy, and that irritates that lining. So the lining gets more irritated. So you actually can cause yourself to have increased urinary urgency and frequency because of not having enough liquid in there. So it's counterintuitive to what you might think. But remember I told you that as the bladder fills, when it's about halfway, the brain will trigger that it has to go to the bathroom. But if you don't drink very much, it's going to trigger sooner that you have to go to the bathroom because he's going to think that little bit is full. And you're going to teach
Oh,
your
my
bladder to go
word.
more frequency than you should. I do agree that there can be something like too much liquid. But if you're a person that just loves to drink the 10 glasses or however much you want to drink, you will probably go a little bit more. I wouldn't consider that an overstretch of the imagination for that, but we do need to have enough liquid in there for you to have
Okay.
a nice diluted out bladder. And our general recommendation is 6 to 8 ounces.
Nurse practitioners will talk about the drink to not have a UTI. But
But if you think about it, if there's not much in there, remember we talked
Right.
about it being
That's
concentrated.
right.
They're
That's-
not wrong. They're
yeah.
right. Yeah.
Any foods that make it worse?
Well, I'll finish to answer the other questions for
Okay,
you. Then we'll
okay,
go to that.
okay,
Yeah.
yeah.
So we remember how I said that your bladder, as you age, can be more sensitive and irritated, right?
Right.
So we call those things bladder irritants. So coffee is an irritant, and it's an irritant because it's a stimulant, which means it's going to stimulate more impulses to the bladder, make you feel like the bladder starts to contract a little bit more. It's also a diuretic, so it makes you feel a little bit faster. and it's an irritant to the lining in that it scratches and irritates the inside of the lining, which makes your body want to flush it out sooner. So that's why we say caffeine is a problem for people when they, not as they age, but in general, almost anybody who has a bladder are going to be sensitive to caffeine, and obviously coffee is a big one. But it's not that you can't drink coffee, but you need to drink it in moderation. And if you're having a lot of issues, it's probably a good idea not to drink it. Or do you drink a cup of coffee and then follow it with some water so it's diluted so that you don't have as much in there.
Okay.
So caffeine tends to be one of the biggest things. Citrus is acidic, and so that tends to bother a lot of people. So oranges and lemons and grapefruit and things like that.
Right.
And again, not that you can't have those, but when you're having a lot of symptoms of overactive bladder, you want to minimize what you're putting in that lining. You want that lining to be as healthy as possible.
Yeah.
Alcohol is also a diuretic, and it's also an irritant, so that will also cause the lining not to be able to hold as well. So when we eat healthy fluids and eat healthy foods that aren't irritating to the bladder, then the cortex doesn't have to work so hard to try to calm it down. So watermelon is a diuretic, but it doesn't actually scratch the lining. So, but you do tend to go a little bit more frequently, which most people say. But it's not because of the water in the watermelon, it's actually a diuretic. So
I never knew. I have this now image of my bladder that I will carry with me.
good. That is my only goal. I always say I'm a little ambassador.
A balloon that has sludge on the bottom.
Yeah, sorry, no
Yeah.
sludge.
Well, we've got, Jennifer, you'll have to come and speak to our senior group
I would
because
love to.
we have little time and a lot of questions. All right, let's talk conservative treatments. That's you.
That is
right?
me. Yeah.
So what is it? What do you do? I come to see you. I have, from your definition, it sounds like overactive bladder. I'm revealing all of this on TV, but and so I come to you and I say, all right, what can I do?
So what's really neat about what we do in physical therapy is we bring you in for a one-on-one. So you're in a private room.
Good.
And then we will spend an entire hour chit-chatting. And I will tell you that up front. We got lots of questions. And so throughout my question process, you have been, cleared by a physician. I know that you don't need surgery, that you might be on some medications, things like that. Or you may have said that I choose not to have surgery. I would like to try a conservative route instead. So what I will do is based on what we talk, the conversation that we have, I will assess whether or not how much we need to teach you about bladder retraining, about taking rid of those bladder irritants that are in your bladder. I will teach you what I kind of talked to you today a little bit about how the bladder feels and how it works, because the more you know, the more you're going to be able to take care of yourself. And then we'll design an exercise program for you. So we will design exercises based on your specific strength. So we'll make sure you know how to do a Kegel or a pelvic floor contraction properly. We'll make sure you're doing it properly, and then we'll make sure that you're not doing too much, because it's just like going to the gym. If I told you to go run 3 miles at the gym, you'd be like, well, I don't think so, right? Go to the gym and lift 50 pounds, you'd be like, okay, I got this. So, the same thing happens with pelvic floor. So a lot of people try it on their own, and they don't get better because they're doing too much or too little. So we kind of prescribe an exercise program based on their specific strength. And then we will see them usually a week after, just to kind of make sure everything's on track, make sure we discuss how the bladder works, how many times a day should you really be going, those kind of things. And then they kind of do their exercises on their own, and every 2 weeks to reassess. So at the reassessment, I might say, okay, you're doing great, we need to add, or maybe you're doing great and we need to stay where we're at because we need a little bit more time, it's not quite ready to progress. And on a rare occasion, sometimes I'll be exuberant on somebody and give them too hard, and they're just not coming along, and sometimes I might need to back it off. But that's in general what we do in physical therapy. We teach them and educate how the bladder works. We work on bladder retraining, and then we give exercises to them. So part of the exercises are basic Kegels.
Gosh, but I learned those when I was 2 or something like that.
Right,
And
right.
every woman hears Kegel, Kegel, Kegel.
Right.
And
you don't even know if you're doing it right.
no,
Right.
I don't even know, to be very honest, where my muscles are actually located down there that I have control over.
And that's actually, so I have a nice model in my office, and it shows where the muscles are. And the muscles are like a little hammock that holds everything up and where it belongs. So when you do a Kegel, what you actually are doing is you're kind of doing a lift type motion. So it actually pulls up and in a little bit and squeezes around for women the vagina, and for men it will actually give a lift to the penis a little bit.
Oh.
When they actually
Men do them?
Yes, men have pelvic floors, and they have the same problems. Well, different problems, but yeah,
A lot of
similar.
different problems.
Yeah,
But, so you
and then-
teach them to men and
yeah,
women?
we do. And then once we get through some of that, there's also other exercises that we use in conjunction with the pelvic floor that help to build functional activity. So we will teach other exercises. Some of them are really familiar to patients because maybe they had a shoulder or a hip surgery, but we'll teach it with the pelvic floor so that when you do life, when you go to get out of a chair, you don't leak. When you go to reach to get your cup out of a cupboard, that you have, so that you can learn to utilize your pelvic floor in all daily activities. So sometimes when you do Kegels, you'll do like quick ones, or some people said they have to hold. Well, there's two types of muscle fibers in your pelvic floor. So 30% of them are your fast twitch muscle fibers, and 70% are your endurance fibers. So you have to train both of those muscle fibers in order to really get a full benefit out of doing a pelvic floor contraction or a Kegel.
I never knew any of this stuff.
But now you can tell all your friends,
And
right?
now, and I think, so I know people, there are medications, I know that. I have heard the negatives of the medications, that they cause you to be so extraordinarily dry that you can, barely talk.
Right.
And I don't know about any of the surgeries. I've heard that there are procedures one can do or one can have done for women. I don't know though.
Correct. So typically for if you have stress incontinence. So if you have stress incontinence, typically the surgery of choice right now is a sling. And depending on what kind of position you go in, and it actually helps to do a lift to the urethra and the bladder. And remember how I talked in the beginning about the sphincter not holding tight? It actually helps to give that sphincter support, and it actually works extremely well in getting rid of stress incontinence. So it just kind of does the lift. Whereas therapy, if it's not overly bad, the muscles will give that lift. So it's like, I call it like good body mechanics,
Yeah,
sitting up straight.
yeah.
With slouch, I was slouching,
Yeah.
sitting up straight. So exercises can actually improve it so that you can get it. But when it's a certain degree, then the therapy will only help some, because the angle of which the bladder is at is just not going to be strong enough to hold. And that's something that a patient and the physicians would decide together. Because I've had some patients that are pretty significant that have done extremely well in physical therapy without surgery, just with the exercises. And other patients
Even
have
as
tried it.
As they age?
Yeah,
I mean,
absolutely.
85 years old?
Yeah. Oh, yeah. I've had patients well into their 90s come see me. And I've had them
Really?
as young as 16. So
Really?
I have seen the gamut. And to be honest, I honestly expected 65 and older to be who I'd see the most
Mm-hmm.
of. I see the most in 30s and 40s. Is probably
Because after baby, or
I just
not
think I think hopefully it's awareness, and women know that there's something to do. So perhaps maybe some people who are older didn't know there was something that can be done, and they had learned to live with it in their 40s.
Yeah.
And so then they just have dealt with it. So even 25 years ago, because I started doing this in 1998, I expected it to be mostly seniors, and it was not. It was all young people from day one that came in for therapy. So it's kind of
I
exciting.
think you're exactly correct. I think there's a whole lot of us that just think that this is an inevitable part of aging as a
Yes.
woman, or I can speak to that, and that, we gave those Kegels a try 100 times in our year,
Right.
and they didn't do a whole lot. So, medication. And my mother was on the medication for a while before she stopped, but she hated the medication. And I don't know if all of them have the same kind of side effect.
They're a
profile,
lot
but-
more now. So
Okay.
they do have quite a few. So if you do need to go the route of medication, just let the doctor know you're having side effects. And there's lots of, your PA or whoever, your
Okay.
senior practitioner, there's a lot of different medications they can try now that have different side effects. So they try to go for ones that have less side effects, but of course
Okay.
they're not covered as well by insurance.
I
So,
know. Well,
you
yeah,
got to
what-
balance all of
what
that
is?
too. But there are a lot more options. There's also a surgical option for overactive bladder, and they put it's called an InterStim, and some doctors like to refer to it as a pacemaker for your bladder. So it's a little box that has a wire that actually goes and sits on the nerve that helps to decrease the contractions to the bladder, which helps to control the contractions of the bladder. Works really well for some people, not as well for others. It's a fairly easy surgical procedure from my understanding. I've never put one in, but and it's a battery, so when the battery runs dead, they have to take it out and put a new battery in for you. And then you have a thing that looks like a remote control that you can control the frequency of it. But it's a really neat option for people who have overactive bladder, who can't tolerate the medications, that want to go that route, and they do fairly well.
I would much rather try the physical therapy first. I having a pacemaker in my
back
hoo-ha does not
well,
sound
at least
like...
it's, it's been back here, though.
Oh,
It's in the
okay.
back part. But it goes down there, yes. Yeah.
Oh, my Lord. Jennifer, we are learning, and I have never known that this whole thing existed. I truly have not. And I'm so glad that you have enlightened us that there are options besides medication or running to a surgeon that we can say to our family practitioners, hey, let me try physical therapy first. Because I suspect even some doctors don't know about pelvic floor physical therapy. Is that correct? Are you
Yes.
finding that you need to educate them as well?
Yes, but you know what? It's awesome because I think the education is out there now. They're doing a lot more. Newer physicians know, and the physicians have been out there for a long time.
Good.
Have now heard about it.
Okay.
But yeah, I think that they're doing a great job supporting us.
We have 3 minutes left only. Didn't this go by fast?
It does go fast.
I know it. So there's hope. You're saying there is hope.
I'm saying there. So we think that incontinence not really considered normal at any age. But as we get older, because of those age-related changes,
You think it's
and
part of
gravity,
aging.
yeah. But there is hope, and most people get better. I had read a statistic one time that said only 20% of people who experience urinary incontinence actually go to the doctor or say anything, because it's not a topic that's easy to talk about.
It's embarrassing.
It's very embarrassing. But of those 20%, 80% have significant improvement in their quality of life. It keeps people out of nursing homes. It allows people to be able to go to the parties or go to the movies. You know, I had a friend of mine just recently said, for the first time in a long time, I'm not afraid to spend the night at a friend's house. And she's 73.
Oh.
So she's just doing phenomenal. So, you know, it's something that can change your life, you know, to have continence and the freedom and to just have that, you know, confidence when you go out and do life.
Are you in the women's, how do we find you? Now, what I'd like to do at the very end of this show is make sure that your identifying data is at the end, so we can have a phone number and a location. Is that, do I, if I didn't watch this show, would I just look up pelvic floor dysfunction?
Western Reserve does have that on their website. So, and the physical therapy is pelvic floor physical therapy. We are very blessed at Western Reserve. We have 2 physical therapists that specialize only in this. So I see patients from 7 o'clock in the morning to 6 o'clock at night, and all I do is treat this diagnoses and pelvic floor pain and some dysfunction there and some pregnancy-related issues. So hopefully they don't end up, you know, 20 years later with issues. But my colleague specialize in this, and so if you were to have a script, our front desk people know to route you towards one of the 2 of us.
Okay.
So we would get them there.
We're not going to the knee guy or the
Correct.
person who will
the
help
shoulder
her
person, yeah, exactly.
Okay.
Falls and balance
Yeah.
ladies, yeah.
Yeah.
So yeah, we do have that on the website.
Jennifer, I am so pleased you came. I truly am. I learned a lot. As I said, I now do have an image, at least, of what a bladder does look like and why all this happens.
Yeah.
And I'm surprised that it can happen at younger ages. I guess I just never thought of it.
Right. And
So-
then hopefully that was what we're here to do, is bring awareness. And then you can tell friends, because you really can do. I mean, maybe you can start at home. Maybe somebody didn't even know to do a Kegel, right? They didn't know a pelvic floor, even though a lot of people were taught young. Or they've been drinking so much coffee or drinking a lot of Diet Coke, which has lots of irritants in it also. And they can maybe just minimize it and increase their waters, and maybe they can on their own without even coming. But obviously, if they can't, it would be wise to seek somebody out.
I think so,
and
too.
not be among the 80% that suffer for no reason.
Because of embarrassment.
Yeah.
Yeah, no, I think so too. I hope you learned a lot. I did. Jennifer's information will be at the end of this show, And as she said, you need to see your family physician or a physician first to get a referral, but it sounds like a way to go that certainly beats having surgery. So thank you so much for watching, and watch for the information at the end of the show. Bye-bye.